Now we move on to the other ankle ligaments. So now we did calcaneofibular. We're gonna just come to this anterior side, right in the sinus tarsi, right here. And I'm gonna push right there. So we have a ligament, the anterior talofibular ligament. So between the talus and the fibula, we have a ligament, and it's right in that sinus tarsi. So if I suspect someone has an ankle sprain and I want to do a palpation at that point, I would just come in here and say, hey, does it hurt right there? Okay, calcaneofibular. And then obviously on this backside, we're going to have a posterior talofibular ligament. We already mentioned a little bit about this peroneal tubercle, right? Peroneal tubercle is right back here. It helps keep in these fibular or peroneal muscles. So right back here, you're going to have a nice little bump. Cuboid muscle, we covered in the foot. So let me just remind you guys, we're here. Here is the calcaneus, and our cuboid is going to be just distal to that, proximal to the metatarsals. Cuboid will be right in here. You'll notice as I go through these videos, whenever I'm on the cuboid, I usually grab it and go like this to make sure I'm on it. Lots of articulation. So I can move large portions of the foot just by grabbing that cuboid right there. Base of the fifth metatarsal is the bony prominence at that fifth metatarsal. So that as I work up this metatarsal, here's base of the fifth, or styloid process. Styloid process is the tip and on the base. Peroneus longus and brevis. These muscles are also called fibularis longus and brevis. Be able to work both ways because you will hear both clinically. So those muscles start up here at the fibular head. So I'm here on fibular head. Well, peroneus longus starts up there. Peroneus brevis probably starts down here, upper 2/3. So the palpation point for these is right along this outside, and then those tendons are going to come right posterior to this lateral malleolus as they come down. So go ahead and just dorsiflex and evert. So those tendons, so we can actually see peroneus brevis right here as we come down. There is several retinaculums. So if you have forgotten about retinaculums, go ahead and take this opportunity to Google those or look them up in your textbook. But we have several retinaculums that help pin these peroneal or fibular muscles down. So we have a superior and an inferior peroneal retinaculum. So the palpation spots for those, I don't know. They're probably, inferior is probably here, superior is probably more up here. So probably about there and there. Okay. Anterior tibial shaft. So now we're moving back up. We're kind of moving this way on the leg. So the tibia, right? Let me grab our skeleton again. Remember, the tibia is going to span this entire lower leg. And you'll notice on this front side, we're going to have a prominent point. So a shin bone, right? Hurts really bad if you get kicked or hit on that shin bone. So this is a pretty easy palpation point for most of us, right through here. So there's a nice bony ridge and prominence. If you come on this side, it's going to be hard, but it's going to be flat. Okay, so if you're more medial, it's flat. And then if you come up on top, there's a sharp point. So we have anterior tibial shaft. Dome of the talus as we work down. So dome of the talus, I think the easiest way to palpate this, you guys, is you just supinate or invert the foot here. And then that dome of the talus is going to pop out right there. And then across through here. So go ahead and dorsiflex pretty. So notice again, we have great definition of the tendons here that come down. So we've got our extensor digitorum longus tendons. We've got tibialis anterior, and then here we go. There's our extensor hallucis longus tendon right here. I don't know if you can see that on the video moving. So we have these come down, and across the front, we have another retinaculum. So the next palpation point is the extensor retinacula. We have a retinaculum that pins these down so they don't pop up. So that retinaculum holds those down. So the palpation point for that is right there. Okay, sinus tarsi, you can see the sinus tarsi I don't even have to palpate that. Remember, hollow area of the ankle, sinus tarsi right there. And then tibialis anterior, I already mentioned, here's the tendon for that. It's going to come up right on this anterior portion of the tibia. Long toe extensors, just mentioned about those, extensor digitorum longus, extensor hallucis longus, they come up here. They are anterior compartment muscles. Okay, and then additionally, don't ever forget this peroneus or fibularis tertius is an anterior compartment muscle. So there is a portion of us that actually are missing the fibularis tertius or peroneus tertius, but the peroneus tertius is going to come down here from the distal end of the fibula, and it's going to come down right down here towards the fibula. So the palpation point for that is right through here. Malleolus, so we're going to kind of come over here towards the medial side of the foot. You can relax here. So medial malleolus, distal portion of the tibia, okay, medial malleolus. Off of this medial malleolus, we're going to have the deltoid ligament. So the deltoid ligament is actually a group of 4 different ligaments, and they span all through right here. So 1, 2, 3, 4. They kind of go like that. So when these work as a functional unit, so clinically you will often just hear them referred to as the deltoid ligament. It's called the deltoid ligament because they make a triangle. If you'll remember from your geometry in 8th grade, deltoid means triangle. So the deltoid ligament is right there. So if I want to palpate the deltoid ligament, what I do is I would just come right through here. How does this feel? Sustentaculum tali, similar to what we did in the foot and toes video, but we're just looking for that shelf. So there's a shelf which holds up the talus. So, as I'm kind of feeling, maybe I'll take this opportunity to say this. I'm kind of feeling around. It's soft, 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 all soft tissue. But I come up here and there's an immediate bump right there. And you'll notice it's going to hold the talus up right there. Sustentaculum tali, it's the shelf for that talus. Off of that, we're going to have the spring ligament. So the calcaneonavicular ligament, which is going to come right through here, the spring ligament or calcaneonavicular ligament. Navicular tubercle and navicular. Again, this is such an important palpation mark. And let me grab this skeleton just so you guys can see it again. So here's that sustentaculum tali, spring ligament, right? Calcaneonavicular ligament off of that. And then off of this, we're going to have this navicula and the navicular tuberosity. Such an important bony landmark in the foot. The navicula makes up the top of the arch of the foot. So this palpation spot for that navicula is going to be one that you'll want to get familiar with, because clinically when you do an evaluation, that will be a very common palpation site. Talar head. So talar head, dome of the talus. Talar head is going to be right through that same region, right underneath that extensor retinaculum. Tibialis posterior. So again, this is going to be the muscle that comes off of this posterior portion of the tibia. The tendon is going to come down right through this tarsal tunnel. And it's going to insert at the navicular tuberosity. It kind of does this spider web. It attaches to the navicular tuberosity and then most of the midfoot. So it comes down. So the palpation spot for that is right through here. And then the next one, long toe flexor. So our flexor digitorum longus, flexor hallucis longus, they come through this exact same region.